Hello guys, how are you doing? This is Vincent Obita, and today we are going to cover evaluation of a patient with depression. This is a PHQ-9 patient. In the new test of competency for Osce, this is an oral submission that you're supposed to direct to the assessor. It takes around 10 minutes and you're supposed to cover what you are just done in your assessment, in your care planning, and also in your implementation. You will use all that documentation plus the scenario booklet that you are provided with in the initial stages of API, so that you hand over this patient to the next caregiver. So it will be in form of a report where you are supposed to use the SBAR technique, that is the situation, background information, assessment, and recommendation, to pass all the vital informations to the next carer. All this you can do by just jotting what you are supposed to capture. You will be given a paper that contains all those sections, the 4 sections: the situation, background information, assessment, and recommendation. Just something to guide you through, and while doing your oral submission, you can always keep on referring to them and ensure you just capture all those details as well as you can. Now, your submission can take this form. My name is Vincent Obita, one of the staff nurses in Ward 40. I'm going to give you end of shift report of Joseph Smith, date of birth 20th of December 2022. That is in Bay 3, bed 3. That will capture the situation. Then you move to the background. Under the background information, you capture all the past medical history, surgical history, or any relevant history that is related to this patient that the next caregiver ought to know as they provide information. So in terms of this case, we would consider Joseph Smith was admitted yesterday with anxiety, low self-esteem, and self-neglect that has lasted for the last 6 months. All these occurred upon losing his job, and a diagnosis of depression was made. He's currently being managed for depression. He lives with the wife and normally get regular visits of their son and daughter. He smokes, does not drink. He enjoys bike riding and is also a fan of football. He's allergic to ibuprofen and also nuts. And that captures like all a bit of the background information of what you ought to capture. After that, you move to the next session, which is the assessment. And under assessment, you will capture what you did under getting the vital signs or any other recordings that you've done since the admission. So in terms of observation, Joseph has a respiratory rate of 19. The blood pressure is 148/71. The pulse rate is 87. Temperature is 36.1, and oxygen saturations on room air is 99%. Also, he had a PHQ-9 scoring, and he has a PHQ-9 score of 16. Is mobile and independent with activities of daily living, and is currently on behavioral chart monitoring, just to check out for anxiety instances, because the main concern for Joseph right now is just the anxiety attacks, and that would capture your assessment briefly. Under recommendation, you capture all that you'd like the next caregiver to do in their next shift. So for Joseph, I would refer Joseph to the mental health team to ensure there's a continuation of care, and also develop a plan of care that need to be used both in the hospital and also upon discharge. I would also recommend that we have 4-hourly monitoring of vital signs for Joseph, and this ought to be escalated to the nurse in charge should there be any need or any deviation. Besides that, I would also recommend weekly observation of the PHQ-9 score of Joseph, and liaise with the mental health team in case of any deviations to ensure he gets all the support that he needs. I would also recommend that we involve the family of Joseph in his care so that they can provide an extra support for Joseph during his stay in the hospital and also upon discharge, as that will help in managing his anxiety situation and self-esteem, and also the aspect of care, so that there is no self-neglect and things of that kind. That would capture all the elements that you need to pass to the next team. And as you can see as well, we've also just taken approximately 6 minutes to capture all that information. That means that the remaining 4 minutes you can subdivide them, have around 1 or 2 minutes in your initial stages of this session, and just capture some of the things that you need to talk about and jot them down. You will be provided with a paper containing the 4 stages. Jot down some of the things to capture in your situation, the identity, date of birth of the patient, their location, and things of that kind. Then come to the background, capture all the past medical history and social history that is relevant to the admission. All that you will get in the scenario booklet that you are normally provided with. Under assessment, provide all the information on what you examined in terms of observations, in terms of your talks with the patient, in terms of either your care planning, the nursing needs, as well as implementation, the medications that Joseph is currently using. Then under recommendation, based on all that, ensure you refer to the mental health team because this is a mental health case. Then support from the family members, and also the tool that we use to assess mental health issues, and that is PHQ-9 scoring tool. Use that, and with all that, you'd have captured all the information that you need to have. With all that, I appreciate for your watching of the videos. Continue subscribing, liking, sharing, and also for those who are undertaking their Osce exams, just practice a lot. With the increased number of stations, just ensure you practice a lot so that you master all that you need to know, and just go on and deliver what the assessor is looking for. That's the only thing that would make you pass, providing what is expected of you. With all that, wish you all the best, wish you all the success, and for those who are passing, congratulations and welcome to Band 5. For now, take care and bye. See you next time.